Christopher Nolikin at Balder Veterinary Hospital.
Hi, I'm Lindsay Benzulo.
Talking today about allergies in pets.
Spaying and neutering your pet.
Pet weight management. And we're going to talk today about pet summer fun and safety. But doctor.
Mm-hmm.
So she says, I got
You're good girl. You got a lot of treats. A lot of
TD
TD treats.
Up on that table. And welcome back to the podcast. I'm Dr. Christopher Nolikin.
I'm Dr. Lindsay Benzulo, and we have a couple of guests today.
Special guests.
Pretty exciting.
These are my children. So we're going to introduce Sydney. Say hi, Sydney.
Hi.
And Kylie.
Hi.
And how old are you girls?
Yeah, I was going to say, how old are you guys?
9.
We're twins, right? We don't look
Yes.
alike, though.
No.
All right.
And we also have a little guest, too. This
Yeah.
is Lola. Lola's actually older than you guys. Lola's 11. And she is my dog. She's a little Yorkie Terrier that came today to sort of help us with our segment. So we're very excited to have all of you guys here today.
Yeah, so our episode today is about kids and safety around pets, both your own pets as well as stranger pets. So teaching your kids, how to handle them safely. So you guys handle pets really well, don't you think? Yes.
What kind of pets do you guys have at home?
A dog, 2 cats, 2 fish tanks, 2 guinea pigs. Yeah.
That's it.
Yeah, that's it.
That's enough. Yeah.
I think Mom needs some more.
Mom doesn't need
yeah.
any more pets. All right. So, within your own house, we try to teach kids how to handle our own pets so that they don't get hurt. Because realistically, even our own pets that we love and that love us sometimes don't always like new people handling them, or the way that kids maybe will interact with them is a little bit different than adults.
Yeah.
So, with cats, we have 2 cats. Are both of our cats nice cats? Say it out loud.
No.
No. We have one cat that's a little challenging. What's her name? Zephyr. But we know that
Zephyr.
she's really good with kids, right? Not all cats are, but she's actually better with kids than grown-ups.
Really? She likes kids.
She
She likes you guys
does.
better than your
She
parents.
does.
Interesting.
So when you guys were babies, you don't remember this, but we never left you alone with the animals, dogs or cats, because we really consider that to be a pretty unsafe thing for kids, is to leave them unattended, right?
And that's really like any animal. I mean, even the nicest dog,
Yeah.
the nicest cat. I mean, sometimes the nicest cat, if you leave, your baby alone sleeping in a crib, I mean, your nicest cat could go in and want to cuddle and
lay on their face.
And we all know that, you're not supposed to have anything in that crib with that newborn child. And so, you get a big cat, a 20-pound cat in there,
Yeah.
trying to cuddle up right next to their face. That could be very, very
Imagine our
dangerous.
cat Sebastian laying on your face if you were a baby.
It's not
good,
safe.
right?
Not safe.
Okay. So then when you got a little bit older, we started to teach you something, which is how to pet the animals without grabbing them, because little kids like to grab things. So we would teach you gentle.
Mm-hmm.
Be gentle. That's what we did. So, really when kids start to get older, they can start to interpret the body language of animals, so cats. So what do you guys think? Look at this cat.
So the cat's got his eyes closed.
So he's kind of getting his chin scratched. So what do you think? Is that like a happy cat or an unhappy cat?
Happy cat.
Yeah.
Look at his ears. His
Yeah.
ears are nice and up, and he looks very relaxed. What if we change that cat a little bit? And what if his ears were like pointing downwards, like if they were
Like
flat,
back.
like back,
Like that.
Not
How do you-
happy.
Oh no. Would you go over to that cat and like stick your head in its face?
No.
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 I mean, that
So-
cat's eyeballs. See the pupils, the black part of the eyes, they're a little bit dilated. The ears are back.
So what we'll describe there is that, this cat, especially for our audio listeners, this cat has its ears back, and it's really trying to make itself kind of look very small, because it wants to say, like, I'm very scared of you and I'm not a threat. So leave me alone and I'll leave you alone. Everything will be okay. So a cat that's trying to make itself look like a little smaller, you want to stay away from that cat, because it could go after you if it doesn't think you're leaving it alone. Right? Okay. How about that cat? So now we have a cat that's just laying on the ground and kind of, does that cat look friendly or unfriendly or?
Happy.
He looks
It
happy.
looks friendly and happy.
Does he look like he's sleeping, or does it look like he's like in the middle of like playing or doing something fun?
playing?
Yeah.
Yeah.
How can you guys tell that he looks like he's playing?
Because he has his paws crossed and his eyes are open.
His eyes are open. They almost like look like they're looking at something on the ground, right?
Like
there's
a
little
laser
toy
pointer
or something there.
over there. Yeah. So cats that are playing, they're having fun, but sometimes you can get hurt by cats and dogs that are playing too, right? Have you ever been playing with Sebastian and he got a little rough? They get a little rough sometimes. Yeah.
Yeah.
Like he like kind of rubs his teeth against.
He's so hard, right? Just rubs. So, you know, if a cat's like,
Oh, there, perfect segue.
there's the
into
cat
this
that's
one.
playing. So,
Yeah.
you know, if they're like, they got their teeth out, they got their claws out, and they're like going after something, do you want to get your hand in there?
No.
Probably not. So what could you do you think? If you wanted to still play with the cat?
You could ask to have the toy or whatever they're using.
Yeah,
great
you could like
idea.
play with the toy instead of getting your hands in there, right? You
Yeah.
don't want to get in there. And what about a cat that's like laying on their back with their belly showing? Like,
Don't pet it.
good,
pet
You've learned.
good answer.
You've learned.
Because that's the cat that they're like gonna get you, right? Is a cat laying on their back somebody that is the same as a dog laying on their back?
No.
Not quite the same,
This
right?
is a cute little kitten.
This is a cute cat.
He's in a little harness. He looks like he's sitting on a scale at a vet's office.
What do you think? Is that a happy cat, a relaxed cat? Is that an angry?
He looks like relaxed. And
Yeah, he looks pretty chill.
You're really good
Yeah.
at that. If
Very
looking up that he's
good.
relaxed. You know, he doesn't look super anxious. His ears are okay. His eyes look okay. You know, they seem to be, you know, looking straight ahead. They don't seem to be. He doesn't have an overly nervous face. It's hard to pick up body language. You girls are pretty good.
But that, you know, one thing with kids a lot of the time is just being aware that they're in the vicinity of the cat and watching how the cat is reacting to that. So sometimes it'll be very relaxed and you can just keep one eye on the kids but everything's okay. Sometimes you can really catch it. You like, I've run across the room screaming, "Don't touch that cat! Look at what he's doing!" And that teaches the kids a little bit to not get hurt, right?
Yeah.
I've never done that.
I know that upsets you if I yell, "Don't!"
It's hard. It's hard though because I mean, body language is something where I mean, cats and dogs, they can't talk, they can't communicate. You know, if you're playing with your sister and she's annoying you, you know, you start going, "Stop, stop, stop, stop." You're saying things to her that she knows that she might be like annoying you a little bit, right? So
that never happens.
You guys get along all the time. But when that happens, you guys can talk to each other. Dogs and cats, they can only, you know, communicate just by the way that their body language, the way they hold their bodies, what they do with their ears, their eyes, their face, their teeth. So it is really important to kind of learn their language.
So then dogs, like, so we have a dog. We have Lola right here.
We brought Lola.
This is Luca, who's famous.
Luca is famous.
Luca,
I don't even know that dog.
You
that
don't know
dog
him?
is on all of Bulger's marketing stuff because he's the most beautiful dog in the entire world.
So how does Luca look? Luca is this gorgeous, I mean, probably one of the best looking dogs I've ever seen. Terrier mix that has his mouth wide open, looks like he's panting, looks like it's a nice summery day, probably in some part of Boston or something. It looks nice. How does that dog look to you guys? Does he look happy?
He
Yeah.
looks like
Yeah.
he looks like yeah, he's happy.
He looks
He's
happy. I
happy,
agree.
yeah.
I agree. I think
Yeah.
he looks pretty happy. How would you go up to him if you know you saw him on the street? How would you go up to him?
and there's an owner attached to the leash.
Yeah.
I would probably ask the owner before I did anything with the dog. Like if it's nice.
You'd say, "Is your dog nice? Can I
Pet it.
I pet it?" Yeah.
That's really good. And then, you know, I think it's the most important step is to first ask the owner because they know best. But then I think not to ignore any of the signs that the dogs might be giving you too as well, because sometimes owners.
So what if
Yeah,
what if
Luca
you
look
walk
there?
up to the dog and the owner says, "Oh yeah, he's nice," but the dog is doing that?
Then you shouldn't pet it.
Yeah, I wouldn't pet that dog.
I mean,
So that's the same dog.
he's not a morning dog.
So what we're describing here is that he's showing his teeth. He's kind of got his little lip curled a little bit, and his ears are facing forward.
His eyes are pretty dilated. He's not looking very happy right
So
now.
he didn't have his coffee yet that morning. He was unhappy. But yeah, they'd show you a lot of body language that might be really clearly aggressive. But then we also have like, what do you think he's telling us?
He looks
So now
sad.
he looks sad. Yeah. What do you think? Or
Maybe he's cold.
maybe he's
He's
cold.
in the snow.
Yeah.
No.
So
Yeah.
this dog, this is also Luca, and he's got his eyes, he's looking one direction, his eyes are up this way. He's sort of looking away a little, and his ears are a little off to the side. And so sometimes they're showing you the signs that they're a little nervous and they don't know what you're going to do. Do you think a nervous dog is a dog that you should just run right up to?
No.
No, probably not, because
Yeah.
that's a nervous dog is kind of saying, you know, I'm okay right now, but I'm keeping my eye on you.
Yeah.
So, and then here's Luca again.
Luca is just
Luca's so
the
photogenic.
many faces of Luca.
Yeah.
Like, I just can't get over it. He's got a lot
So-
of faces.
What do you think about Luca here?
He looks kind of like maybe looking up and saying maybe he wants something like that.
Yeah,
I
that's
think he maybe
Yeah.
wants like a cookie,
Yeah.
right?
Yeah, I
Yeah.
could picture Lauren
dog
holding a
treat.
cookie or saying his name or something, getting his attention. So his ears are forward, his eyes look happy. Don't they look happy?
Yeah.
His mouth is closed. He looks very content. He's sitting very attentively, looking at what she is saying to him or doing.
So in our own house, if it's not a stranger, don't forget that we have a camera there. We have some times that our little dog Lucy is very happy to play with you and really nice, and then we have some times that she's gotten a little grumpy too. What are the biggest time? Do you remember the times that Lucy has gotten grumpy? When was that?
Maybe like if in the morning, maybe because like she just comes down with you, she follows you everywhere.
Yeah.
So like maybe in the morning when she's just coming down and I go over and I want to pet her, she kind of like growls a little bit.
If
but
she has
s-
something
very
on her mind,
softly,
yeah.
Just soft. Maybe if she's hungry.
Yeah. So sometimes dogs in the house get a little like food aggressive. So if they're eating or they're playing with a food type of toy, and you walk over near them and they start to growl at you, you might want to back off because they might be trying to protect their food from you eating it.
Yeah,
They
and
don't know how yucky it is. You tried it. What'd you think of the dog food?
It's terrible. Yeah,
Terrible, right?
pretty bad.
Or
Yeah.
if there's like a food that it can't eat, then and if you accidentally drop it, the dog will go for it.
That's
and
true.
then you try to get
Yeah.
the food away, they'll bite it.
Yeah,
that's a really
sometimes
good
they
point
do.
too.
Right.
That's really. I mean, if you're having dinner with your dog, I mean, you've got to know because some dogs actually don't care about
Right.
it. Some dogs aren't food aggressive. Lola actually, she has certain treats that we give her, certain things that she likes to chew on, and if somebody tries to take it away, she does get very angry and she just kind of walks away with it. So she doesn't mind if you touch her kibbles, but there are one type of treat that she has, which I only give her if the kids aren't going to be home because she just doesn't like it. She likes to just be in her world chewing this one particular type of toy, one treat.
You also have to know that dogs will act differently around the different members of their family, right? So you just said Lucy follows me around. I can take pretty much anything away from Lucy. She will not growl at me. She will not mostly bite at me.
Pretty much do anything to
I can pretty much do anything to her. But if you dropped something, she might growl a little bit at you. I think because she thinks you're her sister.
Yeah, I think she does too.
Right?
She probably
so
thinks.
she wants to say, hey, that's mine. Just like you guys fight a little bit, she fights a little bit with you.
Yeah.
And then one other big time is when she's sleeping.
Oh, if she's sleeping, you try to wake her up. Does she not like that? No.
If you step on her accidentally, like it's totally accidental, but while she's sleeping and wake her up real quick, sometimes
Scares
she
her?
goes, ah, right?
Yeah. Well, and she can't really hear either, so it's tough because she can't even hear you guys coming, right? Because
She thought you snuck up on her.
Yeah. Yeah.
So do you want to take little Lola for a
Yeah,
little test
so
drive and see how the kids
Lola, yeah. So we're gonna do a in-studio demonstration of Lola coming up to you guys, kind of greeting you guys. Okay. So I'm gonna get up. I'm just gonna. Hopefully my mic won't get too stuck. Let me just try to gently get out of this chair.
Oh, you're
Am I stuck?
if
Okay,
you're
move
not
it.
totally stuck.
I'm
I
gonna
think
pull
you're
it.
okay. Just pull it.
Here we go. All right. So I'm going to put Lola down on the ground. There she is. Okay, and so if I was going for a walk, just like you guys said earlier, I'm coming up here and you see this adorable little dog, what would you guys say?
I would say, is your dog nice?
Oh, that's perfect.
Can I pet it?
I would say yes, she is. She is very nice. Do you want to come and pet her? So let's see how much you guys have, how much slack you have. You don't have much slack there.
Okay.
All right, so why don't you just sit, you might need to sit down, Sydney, sorry.
You can
let's
just
see. Let's
bring,
see.
see
Come
if
on,
you
Lola.
can. Oh,
No,
she says,
no, I don't want to go. I don't want to go. So Lola.
So reach out how would you reach out your hand to Lola?
Yeah, I'm gonna bring Lola. Come here, Lola. This is your moment to shine. Yeah, how would you reach her if you?
I would do
That's
Let her
perfect.
sniff.
So she
Yeah.
sniffs. She might even give you a little kiss. Lola's been here for for an hour.
And then and then go ahead and pet her.
Yeah. Good.
And so sometimes if a dog you don't know a dog too, you can also reach in it and pet them underneath their chin instead of over top of their head, because sometimes over top of their head makes them upset too.
And what did Lola do when she first saw you today? What did she do right away?
She was kind of a little afraid of us.
Was she
You
afraid of you?
think?
What did you think she did as soon as she saw you? Did she jump up or did she
rolled
roll
over
over?
on her back.
Yeah, every time she meets somebody new, she rolls right over on her back and just sits there and waits for you to give her belly rubs, right? Yeah. So she
And most dogs, when they do that, that's actually fine. It's a little bit of a submissive gesture,
right.
you know, but it's usually okay to rub their bellies. Better if they're wagging their tails.
Yeah. Yeah, 'cause
Right?
she was wagging, wasn't she wagging? She kind of turns into a little comma. She wags her little bum and then rolls over on her belly, right? She's letting her know that you guys can go up to her and pet her, and that's okay. But it is important to check with the owners too as well. Yeah, you guys were great with her.
Yeah,
Great with
very
her.
good. And then finally, you know, some of the caged pets, we mentioned we have guinea pigs. What's the thing that you always have to do after you play with the guinea pigs?
Wash your hands.
Right.
Mm,
So
that's
any
good.
of the caged animals, you know, reptiles, any of those guys, you should always be washing your hands because they can pass you diseases.
And I think that we always, try to focus on, kids making sure they're safe around, dogs and cats, because we do, it's unfortunate if you ever have an incident where they're biting or scratching. And then on the flip side, you have to sort of, be cognizant of your pets around kids too as well. There are often, like Lola is a perfect example. She's a very tiny little dog. She's able to be, any kind of kid can kind of lift her up really easily. So you don't want to put your dog in a challenging situation with the kids as well. You want to make sure that your dog is safe too. Lola had an incident once where one of my kids was trying to do something very innocent, but lifted her up and put her in a place where it was quite a distance to drop for a little dog. And so you do have to be really, really careful about it. It can happen in the best homes, the homes where you're trying to keep an eye on them and watch them at all times. So you just want to make sure you're keeping your pets safe as well.
So then we had a little under the scope segment where we talk a little bit more depth about a topic, and this is a little bit about kids, but you guys can give us your input if you want, but mostly we're going to talk about that. So there was a case recently in the news of a young boy who died in the state of Florida from rabies. So we wanted to talk about this, not in any way judging the parents. I want to be very clear on that. They've had a tremendous loss and they've lost their child, and this happened, because a lot of people don't know that much about rabies. It's such an uncommon disease.
Oh, totally.
So I don't want to see any negative comments about the parents on the YouTube side. I don't want to see any of that because that's just inappropriate.
Yeah.
But we are going to puzzle through that situation and go through the steps that the parents or you could take in that situation, because I think that if we could get the word out about this and save even one kid, then that would.
I totally agree.
Make it worth it.
I think the majority of the problem is just sort of the lack of knowledge, and so having us do this segment is purely for the fact of trying to give information to you guys, so that way this won't ever happen again.
Yeah. So let me set the stage. So I don't know, the intimate details of it, but the father had caught a bat. I'm not sure where, but somewhere in the house or outside, and had put it in a bucket. And he said to his 6-year-old son, "Don't touch the bat." And then the son touched the bat and got bitten or scratched, on the hand. They had looked at it and said, we probably should go to the doctor, but then the child balked and didn't want to go because of shots, which I totally get, right, guys?
Because if you
Shots
get
out.
bitten by something, that they suspect is rabid or might have rabies, and you don't have that animal there to test it, they will recommend to do prophylactic vaccination, which is a lot of shots.
They decided not to do that because they didn't want to upset the child. And about 2 to 3 weeks later, he started to have signs of neurologic problems, numbness, and went to the doctor. And they did tell them about the bat exposure. And unfortunately, the doctors knew immediately that that's most likely what it was. They tried an experimental treatment that has succeeded in just a handful of cases, and unfortunately it was unsuccessful and he died. So, at many steps in that, the saddest part of it really is that wouldn't happen to Lindsay or me, because we have enough knowledge about rabies that it just wouldn't. But my husband schooled me about the fact that, in the general public, he said that could happen to him, that could happen to probably your husband without the medical knowledge of this. So, I think, picking it apart, the first thing, I'm going to sort of chuckle at this a little bit, kids will not resist an animal.
Yeah, it's
right?
hard. Hard.
It would be really hard for you not to try to look at that bat, right? Because bats are cute, right?
I would look at it.
You would look at it.
But the thing that's tough too about some bats is some of those bites, they're so razor thin that it's actually sometimes really hard to tell if you've been bitten by a bat, which can be a little bit scary, because you can maybe open the box, the bat might flutter around, and you might be kind of, distracted by what's going on, and had moved the lid and then put the lid back down, and you're not quite sure. You felt the bat near you, but you were like, I don't know if it bit me or not. Their bite wounds can be so razor thin, it's really hard sometimes to even tell if you've been bitten.
So we say a bat that is found in the vicinity of a sleeping person, especially a child. So if you find a bat, even though it looks healthy, in a kid's bedroom, or having had any possible exposure to a child, frankly, if I found a bat in my house, I would be having that bat tested. And yes, testing the bat involves the bat is euthanized humanely and their brain tissue is tested, and that's just a fact. I've seen people, really upset about that fact online and saying, I'm not going to get the bat tested. I'm going to get the bat tested to protect my family. So, step number one in that case, the first thing would be, just not allowing a child any exposure to any wild animal, because all mammals can carry rabies, bats and raccoons, and what's the other one?
Possums.
Well, possums are lower risk, but
they're low risk.
Woodchucks. So you don't want to be, what?
Bunny?
Bunnies are not very high risk, but I still don't want you to really have any exposure to any wild animals. So no exposure to wild animals. And in the case where a wild animal did expose a child or a person or a dog, then that animal, if available, should be tested.
Yeah.
So step number one that could have changed the outcome in that situation would be take that bat to your local animal control or veterinarian and have it tested for rabies. Mm-hmm. That bat would have come up positive for rabies and they would have known. Step number two, rabies post-exposure treatment.
Yeah, I mean, if you have any suspicion that you or your child has been exposed, or your pet has been in contact with this animal, they've been in close vicinity, like Dr. Van Alken mentioned, you find it in the bedroom, anything like that. I would highly suggest you talking to your physician and considering and doing prophylactic treatment. Rabies vaccination, it does require shots. But when you're dealing with a disease that's almost 100% fatal, if you contract it, it's just not even a question.
Yeah, so, once an exposure happens, you have somewhere around the ballpark at least of 10 days to 14 days to get the post-exposure prophylaxis. And if you do that, you are nearly 100% certain to not get the disease. If you start to show signs of the disease, you are nearly 100% certain to die.
Yeah.
So it's a pretty black and white thing, and so I know that bringing your child in for getting, a 5 vaccine series or getting an intravenous injection and then some vaccines, it's going to be hard for them, but they will survive this because they had that done.
Yeah.
So, I mean, I think that's kind of it in a snapshot.
Yeah.
And, keep your pets up to date on rabies. Your pets are the sentinel for all of this. Your pets serve as a little bit of a barrier. They are way more likely to get exposed to any wild animal.
Yeah.
But if your pet contracts rabies, your family is at very high risk. Fortunately, there are only 1 to 3 cases of human rabies a year.
Yep.
Only a couple hundred in dogs, but there are a couple hundred in dogs, and more in cats because we do have a fairly large wild or feral population of cats that can get exposed. So there's, I believe it was low thousands numbers of cats. Rabies is out there.
It's out there, and I do think that the reason why it's not more prevalent, at least in the U.S. that we can speak of, is that we have such a good vaccine protocol for a lot of our domestic species. But yes, in the wildlife, unfortunately, it's there, and it's not going anywhere anytime soon. And so just making sure that you realize how dangerous it is. And if you have any questions, call your vet or call your animal control officer.
Or your physician if there's a human exposure.
And figure out, I found this animal, is this something at risk? There are some animals that you find, you girls were saying a couple of animals, but yeah, things
Bunnies,
like a
squirrels,
chipmunk or a squirrel. You're talking about, any mammal has a potential, but as far as the reality of whether or not this is a really significant danger, I think it's important to check what kind of animal it is and talk to those appropriate avenues or those appropriate channels.
And rabies vaccination is available, but only for usually high-risk individuals. Veterinarians are considered moderate risk, actually. Higher risk people would be if they work in a lab with the virus. And people who go spelunking, caving, can be exposed to bats.
Yeah.
So, yeah. Well, that's it for today's episode of the podcast. Thank you for joining us.
Thank you guys for coming. We really had
Say
fun
goodbye.
with you
You're
guys.
welcome.
Goodbye.
Bye, guys. Thank you. See you next time.
I'm Dr. Christopher Nolikin.
Dr. Lindsay Renzullo, email us your questions, and we'll see you soon.
And I'm Kylie. And I'm Sydney.
Oh, yes. Yeah, we can't forget Kylie and Sydney. And I'm Lola.
Bye. And we're now available in an audio podcast. You can search for us on iTunes or Google Play under the podcast or by searching for Balger Veterinary Hospital.